As women, we go through so many things, both emotionally and physically. And PMS is one of those things. My name is Dr. Ipeleng, and I make videos about women's health. What is PMS? PMS is a set of emotional and physical symptoms that appear 1 to 2 weeks before your menstrual period. That means the symptoms come a few days after ovulation, and the symptoms happen because there is a significant drop in the estrogen and progesterone in a woman's body. Some women get very mild symptoms before their period, some don't get any symptom at all. And after menopause, when you are no longer having your periods, these symptoms disappear completely. You will have, of course, other symptoms that are associated with menopause, but the PMS symptoms stop once you stop having your period. Severe symptoms of PMS may be a sign of something more serious called premenstrual dysphoric disorder. Although anyone can get PMS, it affects mostly women who already have high stress in their life, women who have a history of depression or anxiety, or women with a family history of mental illness, which includes the depression and the anxiety. If you've been wondering whether your PMS symptoms are going to get better or get worse as you grow older, they do actually get worse in your late 30s, your 40s, and the period just before you get into menopause called perimenopause, unfortunately. Let's talk about who gets PMS. About 75% of women, which is 3 out of 4 women, will get symptoms of PMS at one point in their lifetime. Most women have very mild symptoms, and only 5% of women will get the premenstrual dysphoric disorder, which is a much more severe form of PMS, as we have already mentioned. This is especially true for women who are very sensitive to hormonal changes in their body. Why do they get worse as you approach menopause? Because your hormones, as you approach menopause, they go up and down in a very unpredictable way, which can lead to mood swings or the worsening of the PMS symptoms. Now, the symptoms of PMS, remember, they are not the same in every woman, and they may change throughout your life. The physical symptoms, remember, we have the physical symptoms and the emotional symptoms. The physical symptoms include breast tenderness or swelling. You may notice like a bit of swelling and tenderness a few days before your period. The constipation or the diarrhea, the bloating or the gassy feeling that you just feel like you're so bloated and your stomach is just out there. The cramping, you might start having the cramps just before your period, continuing into your period, because we are familiar with the cramps during the menstrual period, but the cramps may even be there when you have PMS before your period. So there's the cramping, and you are sensitive to light or noise. You don't want anything to do with noise around you, or you're just irritated by the noise. A few days after your period starts, these symptoms go away because the levels of estrogen and progesterone begin rising up again. It is important to know that the symptoms are not the same in every woman. They are very different. They can be different. And also that the severity of the symptoms are very much different in every woman. The emotional or mental symptoms, you may notice that around this time you are very irritable and you have hostile behavior, which is not your normal way of behaving. You may also start having sleep problems. Either you sleep too much or you sleep too little. You're not able to fall asleep, or you just can't stop sleeping. You may notice also feelings of tiredness. Your concentration is poor. You're not able to concentrate and focus on whatever that you are trying to do during the time of the month. And you start craving, especially sweet stuff. You're craving sweets, you're craving cakes, and it's all these kinds of cravings around the time of the month. The tension and the anxiety. you also have feelings of depression, you are feeling sad, and you are having all these crying spells around this time of the month. I guess it's obvious that you will also have the mood swings, and naturally your interest in sex changes, because I mean, if you're not feeling good emotionally and physically, your interest in, in doing those kind of things and having sex and, feeling good about yourself is gonna change as well. What causes PMS? We have already somewhat covered this one, but basically it's the changes in the hormone levels during your menstrual period. How do the doctors diagnose PMS? There's no single test for diagnosing PMS, but if you have some of the symptoms that I've already mentioned, you might have PMS. What you can do is every month, if you think that you have PMS or if you suspect that you have PMS, write down some of the symptoms, pull out your diary, pull out your journal, write down some of the symptoms that you have for 3 consecutive months, and then take that journal with you to see your doctor or to show your doctor in order to make the diagnosis of PMS. By the way, not only should you have some of these symptoms, but if these symptoms are interacting or stopping you from doing the things that you usually enjoy, if you like going out, if you like cycling, or if you are not even able to go to work or you are not able to go to school, you might have PMS. So this is when you should be worried about PMS, because to be honest with you, every woman have some of the symptoms every month, you know, but most of the time they're mild. How PMS affect other health disorders? Most women who end up needing relief from PMS symptoms also have other health problems. The main one being depression and anxiety. Most women who have depression and anxiety will have their symptoms worsening around the time after ovulation, which we discuss as PMS. So the symptoms overlap. If you have depression and anxiety, you'll notice that 2 weeks before your period or a week before your period, your depression may get worse, or the symptoms of your depression may worsen. Or if you have anxiety, the same thing. Chronic fatigue syndrome. Women who have chronic fatigue syndrome also report that around the time of their period, their symptoms get worse. They get even much more tired. We discussed tiredness or feelings of tiredness as one of the symptoms of PMS. IBS, irritable bowel syndrome. IBS causes cramping, bloating, and gas. Your IBS symptoms may get worse right before your period. Another syndrome called bladder pain syndrome. Many patients with bladder pain syndrome may report having a lot of cramping just before their period and even during their period. Okay, we've discussed the symptoms and what PMS is. Now, what can you do at home to relieve the symptoms of PMS? Most of these things that I'm going to mention are actually things that will help you to have a much more healthier life. And number one is exercises, especially aerobic exercises. They will help to relieve some of the symptoms of PMS, such as the sadness and even the fatigue and the bloating as well. The diet, you have to change your diet. Generally, we have to eat healthy, but especially if you have PMS, avoiding foods that have salt, that have sugar and caffeine, foods and drinks, will help you to relieve some of the symptoms of PMS. I know around this time we spoke about cravings, so you're going to be craving your sugars, you're going to be craving the sweets, but try by all means to avoid them. Get enough sleep. There are always debates about how much sleep is enough sleep, but getting 8 hours of sleep at least every day will help you to fight some of the symptoms of PMS, such as moodiness and sadness or the depression, because generally getting enough sleep or not getting enough sleep actually increases the risks of getting depression and anxiety. Find healthier ways of dealing with stress. I mean, we are in this life, and at one point, we are going to have to deal with stressful situations, whether it's work, relationships, family, whatever it is, or money. So, finding ways to manage your stress in your daily life is very important. Speak to your friends, start journaling. Some people are helped by things such as meditation and prayer, or even exercise as well, which I've already mentioned, helps with managing stress. Do not smoke. It has been reported that women who smoke report severe symptoms of PMS, or they report to have symptoms of PMS more than women who do not smoke. I know it's a hard thing to do, but it is one thing that you can do for yourself. Get some help, whatever kind of help that you can get, in order to help you to stop smoking. Okay, so you've tried all these things, you've tried to exercise, you've tried to eat healthy, you stop smoking, but nothing helps. You're still having the most severe symptoms. You can try to get some of the over the counter medications, such as ibuprofen or naproxen. These are medications that will help you with the pain, the cramping, the breast soreness or tenderness. If over the counter medications are not working, you have tried all of them, they are not working, it is time to try prescription medications. Prescription medications, we start off with hormonal treatment or contraceptive pills. A lot of women actually have to try a lot more contraceptive pills, like different kinds, before they get to that one that actually works for them. The second prescription medication that you can take is the antidepressants. The antidepressants that are used with the premenstrual syndrome, or even the severe form, the premenstrual dysphoric disorder, are the SSRIs, that is the selective serotonin reuptake inhibitors. The diuretics, also known as the water pills, this help you to reduce a lot of water because there's water retention during PMS and the breast tenderness. The diuretics, basically you just lose more water, but you pee a lot. That's how you will lose the water retention. Anti-anxiety medications will help to reduce symptoms such as anxiousness. Should you take vitamins and minerals? Well, maybe some vitamins and minerals have been found to alleviate some of the symptoms of PMS. Calcium, which you can find in milk, in yogurt, or in cheese. Vitamin B6, which you can find in poultry, in fish, and potatoes. Magnesium, polyunsaturated fatty acids, omega 3, and omega 6. That is all for today. I really hope that you managed to learn something for yourself, and I wish you all the best in managing your PMS symptoms and having a productive and happier life.